I wanted to zoom out for a minute and try to get your worldview, if you will, or general perspective on leaky gut. And in reading your papers, what I captured is something along the lines of leaky gut may be associated with a number of conditions, but targeting and directly treating the leaky gut probably isn't the most sound approach, but rather we should focus on treating whatever the condition is. If it's IBS, treating that as one example. Is that sort of a fair kind of big picture perspective?
I think it is, and it goes even beyond just gastroenterological diseases. Let me expand on that point. So, if you read the lay literature and even some of the medical literature, it is often claimed, and I'll never forget reading this paper a couple of years ago, which almost said that all diseases start in the leaky gut. And of course, it caught my attention. But this actually drew attention to conditions where the evidence is relatively weak. And we'll talk about the strength of the diagnostic methodology that's available. But to my mind, it is still not completely proven that conditions that affect the nervous system, Alzheimer's dementia, children with autism, there have been so many claims, even obesity, the data are somewhat equivocal. Type 1 diabetes, the data are also somewhat equivocal. So it's very difficult on the basis of the strong evidence that's available for us to review and critically appraise from the methodology. It's difficult to support the statement that all diseases start in the leaky gut. And I think it's important to come back to the general point you were making in your introduction, that there is an important role for us as gastroenterologists, generalists, to be a little bit more careful when we attribute the illness to the leaky gut. And the corollary of all of that is, of course, we should treat the underlying disease, not expect that changing the conditions within the intestines, particularly the small intestine, is likely to have a big impact on those general diseases.
Yeah. And I think that's really important to echo, because as someone who's educating the public on leaky gut, it's hard to strike that balance between let's increase awareness of how your gut might be implicated, but also not lead people to think we have to just target that one that one biomarker in this case. And people may, come into our consulting practice and say, well, I have joint pain. I think it's leaky gut. How do we test leaky gut? How do we treat leaky gut in order to resolve my joint pain? Or same thing for IBS, let's say. And that's where I'll sort of pivot the perspective to leaky gut's probably or could be part of that process. But if there are therapeutics, let's say one example, a low FODMAP diet for IBS, let's focus on the diet that improves your symptoms. And I think it's safe to assume that if you feel better, that underlying intermediary mechanisms like leaky gut are probably going to get better at the same time. And that's really what we should target.
I think that's a very astute point as well, because the benefits from those dietary changes are probably multifactorial, and probably the digestive process of the underlying sugars that are not being well managed by the individual's intestine. That's probably a much more important reason for the bloating and some of the pain, and maybe even the diarrhea, because if lactose, the disaccharide in FODMAP, is not absorbed well by about 60% of the world population. And so, that's just an example of, it's probably not the leakiness of the intestine that's most relevant, but the fact that lactose is getting down into the colon and the bacteria love it, and they break it down to hydrogen and methane and cause secretion of water. And so the patient gets diarrhea and bloating and pain. So, yes, I completely agree that it's important to keep in mind that the benefits may be related to some other mechanism that is being improved by our dietary or our other treatment, rather than by changing the leaky gut.
And there's limitations to the biomarkers. And I want to come to the testing in a moment and talk about there's a general correlation, but there's also good examples we can point to where people become healthier, they have less subjective symptoms, but the biomarker doesn't change. But let's table that for 1 minute just to make sure that we kind of cover some of the associations between leaky gut and various intestinal conditions. Some of these are probably obvious, and the kind of general heuristic I use with people is the more digestive symptoms you have, and maybe the more systemic symptoms you have, we could assume there's a degree of leaky gut present as a general heuristic. But again, we want to be careful not to just claim everything is because of leaky gut. What details would you kind of pepper in underneath that sort of broad claim?
So some of the best evidence for the involvement of the leaky gut, as you said, would be the induction of sort of inflammatory process. There are good experimental models that have changed the intestinal lining and that have been associated with the development of signs of inflammation. We'll just call them like that. So that's one way to think about it. A good example, and you mentioned it earlier, is joint involvement. For instance, in quotes, arthritis, something that could be related. And yes, indeed, there are data in significant joint diseases like rheumatoid arthritis or ankylosing spondylitis, where the evidence of increased leakiness of the intestine seems to be relatively well established.
Right.
On the other hand, let's keep in mind that in much more common conditions that we gastroenterologists see, like irritable bowel syndrome, there are other mechanisms that are going to be at play that are causing those systemic symptoms. We know that the gut can be more sensitive to distension, to the presence of nutrients that are sort of maldigested in the intestine. And that stimulates the nerves that connect the gut to the brain. And of course, we also know that psychological disturbances in those individual patients may also impact the degree to which they experience those pains. So this is my way of trying to explain that, there may be other mechanisms that are responsible for those systemic or brain features, and they may not necessarily be related to the very significant inflammatory processes. Now, of course, I'll be the first to say in patients with ulcerative colitis or Crohn's disease who develop joint pains, that's a very real issue with inflammation. But those are diseases that have a much more leaky gut. It's an order of magnitude higher, and so it's much more likely that the food proteins, the bacterial proteins, are going across the mucosa and causing that systemic inflammation, as well as the inflammation in the intestines themselves. And so that's what sort of triggers the systemic inflammation. Then might land in the joints of the hands or the back and present with small joint or large joint arthropathy.